If your reason for coming into nursing is because of money, then you are going to be disappointed. Let me explain. Hello guys, and welcome to my channel. If you are new here, thank you so much for joining the family. Please stay around. Remember to like, share, and also subscribe to the channel. My name is Yewande Alao, and I'm a registered nurse. I make videos about nursing, health, self-care, and a little bit of beauty. Today's video is about 6 things that you need to keep in mind if you are considering choosing nursing as your career. Nursing is a great career if you are prepared to work hard. So the first question that you need to ask yourself is if you are a hard worker. Because if not, guys, you are going to find nursing very difficult. Nursing is a very rewarding career if you are going into it for the right reasons, okay? If your primary goal is to help people, to contribute something vital to the society, then you found yourself a great profession. But nevertheless, it can also be the hardest thing that you ever do, both mentally and physically. I honestly feel that a lot of people go into nursing blindly, and they go into nursing for the wrong reasons. They end up getting frustrated because of this and miserable with nursing, and even most people end up quitting nursing. Nursing is a great career if you are prepared to work hard. So the first question that you should honestly ask yourself if you are going to nursing is, am I a hard worker? If the answer to this question is no, then you should seriously consider not going into nursing as a profession, because you are going to find it very difficult. And if you are a nurse here, it's very easy to forget yourself. What people don't understand is that sometimes nurses have to sacrifice to the extent that they even end up harming their own health. Even when there is shortage on the unit or in the hospital, you have no choice. You have to pick up the extra work as a nurse. And let me tell you something, majority of your day, most of your day in the hospital, you are on your feet, you are standing on your feet all through work. The only few minutes that you get to sit down, you are even still working, maybe doing paperwork or documenting or something. So you are on your feet all day. So if you are not someone that likes to work hard, you are not someone that likes to be on your toes and get things done, nursing is not for you. If you are someone that is very sensitive or someone that gets irritated easily, you have no business in choosing nursing as your profession. I'll tell you why. As a nurse, you cannot avoid it, okay? You are going to be exposed to blood and other body fluids. Let me even tell you my personal experience. You may say that you are going to wear gloves or you are going to wear masks or protect yourself, but sometimes it's not so. You cannot avoid it. I cannot say how many times I've had patients vomit on my shoe, how many times I've had my hands or my clothes stained with blood, feces, urine, and other body fluids. It's just part of the job. But if you are someone that gets easily irritated and you cannot touch all those things, nursing is not for you. Let me just keep it real with you. As a nurse, you are going to witness people in pain, both physical and emotional pain. You are going to witness people suffering. You are going to witness people pass away, and you are going to witness when people experience grief. Okay? I know it's not easy, but it's just part of the profession. Witnessing a patient suffer or someone in grief is never easy as a nurse. No matter how many times you've experienced it, it's never easy. So as a nurse, you need emotional strength to study nursing. So if you are somebody that you cannot separate yourself from your emotions, even though we preach empathy in nursing, you have to be able to separate these two things. If you cannot do that, then you should really consider before you choose nursing as your profession. Another way to tell that nursing is not for you is if you are not selfless. Because as a nurse, most times you have to put the needs of your patients and their family members before yours. And let me now tell you something, okay? Sometimes even you have to put the needs of your job before your family when needs be. Sometimes duty calls, you have to report to work, you have to stay extra hours here and there. Even when you are having a bad day, okay, you need to always wear a smile because your patients rely on you to comfort them. So your own problems should be left at home. There's a popular saying that we used to say in nursing that once you are coming into the hospital environment, okay, all your problems and your sorrow, just leave everything at the gates before you come in. And then when you finish work, when you finish duty, when you are going back home, pick it back at the gate. So that's just an illustration of how selfless nursing is. You need to keep your own problems boxed, tied up, locked, leave the key at the gate so that you can give your whole self to your patient. If you are someone that has difficulty putting other people's needs before yours, then you should think twice before you say you want to become a nurse. If your reason for coming into nursing is because of money, then you are going to be disappointed. Let me explain. You know what? Despite the fact that Nursing is a field that is very lucrative, and you are exposed to endless opportunities, and there's opportunity for career growth here and there. You are able to pick extra shifts, jobs are available and all that. There's a very high probability that the money that you earn, the pay that you earn, is not going to be equivalent to the amount of work that you do. You don't get your holidays, all your weekends are not available to you, and also you miss out on a lot of family and social functions and activities. Basically, your social life is almost zero. So wait, before we go too far, don't get me wrong. If you are a nurse, if you're working as a nurse, okay, you'll be able to earn enough that would take care of your family, that you'll be able to take care of your parents here and there, little. Generally you'll be able to live a comfortable life, okay, but nothing extra. If your goal for coming into nursing is to earn so much money that all those your dream of buying expensive designers like Gucci, or buying expensive cars, Lamborghini, Ferrari, building your expensive mansion in Hollywood, or 10 mansions in your village, my friend, you are going to be disappointed. If you look at yourself, honestly look at yourself inward, and you know that you see yourself as not being a people person, which is my 5th point, okay? What I mean by this is that you are not somebody that has good human relation skill. You cannot talk to people, you cannot communicate to people, you cannot interact. You have very low communication skill, and your confidence level is very low. More like the customer service job, and you cannot do it. Then you should really think twice and consider before you choose nursing as your profession. So as a nurse, okay, your communication skill and your confidence level should be top notch. Finally, guys, I cannot overemphasize this. Parental pressure should not be the reason why you decide to become a nurse. Let me repeat myself. Do not decide to become a nurse because of pressure from your parents. If you don't have the genuine interest, okay, and passion to care for people, to be a nurse, you are going to become miserable. Every day that you go to work is going to be like torture. And this issue of parents forcing their children into studying courses like nursing, medicine, engineering, and all that is very common. Don't decide to become a nurse just because your parents are pushing you into it. At least do your research, do your findings, find out what it entails to become a nurse, and decide for yourself. You should be the only one making that choice, not your parents, not your friends, not your relatives, nobody. Only you should be the one making that choice, because at the end of the day, you are going to be the one in it. You are going to be the one that will end up miserable and frustrated. And at the end of the day, you may even find out that you are going to love it. So it's on both sides of the scale. So you need to make that decision yourself, but make sure you make an informed decision. So one more thing before I go. If peradventure, this is very important, please listen to me. If peradventure you don't have any of the qualities, or any of the all these tips doesn't apply to you, and you have the genuine interest to care for people, you have the genuine interest in nursing, let me tell you, all hope is not lost. You can work on yourself, you can do better, you can be better, you can try and strive to be a nurse, you can work on yourself, and we can only get better one day at a time, because only if you have the interest is when you can enjoy the benefits and the reward that comes with being as a nurse. And I'm not talking about monetary reward here. I'm talking about the satisfaction the joy that you derive from nursing. That is only when you can enjoy it. But the first step is to have information about what it entails to become a nurse, and a good nurse, okay? So if you have this information, you'll be able to make your decision by yourself. You are the one that should make that decision, because that is the only way you can enjoy the benefits and you can feel satisfied and fulfilled with the career. I hope you enjoyed this video, guys. If you did, please like, share, and subscribe. Press that subscribe button and turn on the notification bell so that you never miss another video of mine. Thank you so much.